couple of years ago, when I was at Shaker High School, and I talked about suicide prevention. And at that point, I had lost like 3 friends that committed suicide. And I said I'd never let that happen again. I said to myself I would make sure that I do everything in my power to make sure that we can identify people that need help and be there for them, especially as community leaders. It's nothing sexy to talk about. No one wants to talk about it. No one wants to talk about issues. No one, God forbid anyone in this room doesn't want to know anyone. And unfortunately, this country's been at war for 18 years, and most people don't even realize it. Back in January, I had to go down to Florida and bury a friend of mine that committed suicide, that did 4 tours in the military, and served over 20 years with them. And it was hard. And I'd like to tell you that was the first military buddy I lost. It was not. 3 or 4 have followed since then and before him. 22 a day. 22 a day. Soldiers commit suicide. And it's just not, if that's not alarming enough, 33,000 people a year in this country commit suicide. 33,000. That's like taking the town of Bethlehem population and saying tomorrow morning they're all gone. And what can we do as leaders or departments that are involved in the trenches day in and day out to make a difference? And it's been the million-dollar question that I've had for the last couple of years, and I've had pretty much my whole life of dealing with this. Because it's tough. We're all busy, right? And I always say, take the time to listen to a friend. Take the time to listen to someone else's problems. You go on Facebook, social media, and you see happy stories. No one puts up there, hey, I had a miserable day. Oh, I got my teeth kicked in today. Oh, today, whatever happened at the office or at home. We don't talk about that. You just see great things mostly. Very few will post something serious. Or they say, oh, that person's looking for attention. They're crying out. It's the signs that we miss. I'm happy here to stand here with my colleagues to talk about eConnect, a pilot program that we're starting. And basically, it's going to be app you can download, a tablet, website you can get on. If you look at youth from the age of 10 to 24, it's the second largest problem in youth today in this country. Second largest, suicide. But we're hoping that with this partnership that we're launching today will give us an opportunity to try to figure it out, give someone an opportunity to get on and saying, hey, we're there for you. People that go to jail. Unfortunately, we talk about reforms, we talk about no bail bonds, we talk about different issues, but do we give them the support and network they need when they get out of jail? We don't focus on that. We just focus on them not being incarcerated or getting out early or preventing them from going there in the first place, but we don't give them the support that they need. And unfortunately, especially teens that go into the juvenile detention system and go into jail have a higher rate of suicide too. No one wants to talk about that. No one wants to talk about identifying that. How do they turn their lives around? So we're hoping what we're going to be announcing today is going to make a difference. This partnership's not possible without Columbia University, Chestnut Health Systems, to use this specific technology to further study how to better provide these types of services. These screening tools will have ask questions and allow probationary staff to place a child into one of 4 categories based on their answers and will choose the proper response needed to best help them with the team. Our mobile crisis team, with Northern Rivers and our Department of Children, Youth, and Family, will be ready for kids who are deemed immediate of danger. One of the things is that people don't realize is the mobile health crisis team that we have out in the community, 24/7, 24/7. We talk about a variety of things in the community, and people don't realize that this team, regardless if it's Christmas, Hanukkah, whatever the holiday may be, they respond. And we get out into the community. I think you hit a button on here, buddy. There we go. So I'm going to bring Bill up in a minute, but if you go to your tablet, this is something that's going to look like. This is what it's actually going to look like, and you can log in, and you can begin, and it's really simple, and it walks you through it. And we'll walk the person through it, and I'll let Bill talk a little bit more about the technology, but most importantly, we already had someone use it, and we're already making that help that person needs, and that's what it's about at the end of the day.
I want to thank Albany County Executive Dan McCoy for his progressive forward thinking in juvenile justice and all Raise the Age matters. Also, thank you to all our partners in eConnect and all juvenile probation staff who has been trained by Columbia University and will facilitate using the tablet with all juveniles. Albany County Probation will use technology to identify youth who may be at risk of suicide. We are one of 10 probation departments across New York State who will be participating in a collaborative project using this model. The short questionnaire for suicide risk will classify youth into 3 categories. The lowest, class 3, will be not at risk. Class 2 may pose a significant risk, and class 1 who are at imminent risk. Based on projections from Columbia University, 1% of all our population may be 1% at risk, 11% will be class 2, and 17% class 3. As Executive McCoy indicated, suicide is the second leading cause of death for youth ages 10 to 24, and suicide is much more common in juvenile justice system youth. Recognition and early intervention of mental health and substance abuse is key to suicide prevention. Probation staff look forward to this opportunity to assist and advance juveniles forward. Thank you.
Thank you, Executive McCoy. And we are very grateful for this opportunity to speak with you about this program. Northern Rivers applauds Albany County for taking the topic of suicide and suicide prevention so seriously, and for initiating a program that has and will not only reduce juvenile recidivism, but will save lives. We're extremely proud to work with our county partners from the Departments of Probation, Children, Youth, and Families, and Mental Health to shape the mobile crisis services that we currently provide to identify those youths at risk because they have mental health needs, find them early on in the process, and link them to needed services in the community. Our mobile crisis teams have been working for a number of years now for children, and we work very closely with the Department of Mental Health around older kids and kind of bumping into that adult age range. And what we do now is that we respond to phone calls. We listen to people on the phone and we make a decision. Our licensed behavioral health professionals are there, and we make a decision as to whether or not we actually go out into the community to intervene. Our hospital diversion rate is over 85% at this point. The fact of the matter is that while that is a good service, this program provides an opportunity to make it even better. Because of the use of this screening program, we no longer have to wait until people are actually in crisis. We are doing early identification screening that can get people to talk with kids when we know they've been in trouble in the last number of weeks, number of months. And in fact, we know that it works. We've already diverted one youth from going to the hospital, and at this very moment, our licensed behavioral health professional is interviewing a young person that has scaled at a level 2. So I can't wait to see how this program rolls out, and I think we just have an absolutely great opportunity. So we thank you very much for being a part.
So really, the juvenile, this is on a tablet. So each juvenile, when they come in, they will be given this tablet. A probation officer will be with them during this time. So the probation officer will log into the system, will enter some demographic information about the juvenile. And then the juvenile will actually go through each section of this tool and answer the questions. The tablet also, they'll be given a set of earbuds. So the tablet will also speak to them while they're doing it in case they have trouble actually reading the questions. This is done on about a 3rd grade level, so most of our juveniles will be able to read it, but just in case they'll have the earbud. So what they'll do is they'll scroll through this. It answers, it asks them a bunch of different questions in different categories. And the way it's designed is it's asking the question, and then the answers are going to be multiple choice, but they're timed to multiple choice. So we'll say, have you had suicide thoughts within the last 3 months, the last 6 months, the last year, the last week? So that's how the system is worked. So the juvenile will go through, they'll answer all the questions. Once it's complete, they'll hit a button that says it's complete. The answers then go to a scoring system, and it comes back to the probation officer at their desk. So once the juvenile completes this program, the probation officer will go to their desk, they'll log into this system on their individual computer, and they'll get the results. Once the results are sent to the probation officer will then go in and discuss with the juvenile and the parent the results of the screening instrument, and then we have a pathways worked out with our partners. So based on how the juvenile scores depends on what the probation response will be. So for those high-level imminent risk and those second-level class 2s where they're at risk but maybe not imminent risk, the probation officer or a probation officer will remain with the juvenile and the family to work them through the process, what's going to happen next, while another officer is contacting mobile crisis to get mobile crisis to respond to the department. And then mobile crisis will come and they will work with the juvenile and the family to discuss the next steps.